Welcome to the More Than Teeth podcast, where true health transformation begins in the mouth. Join your hosts, Dr. Michael Bennett and Kathy Bennett, as they explore the hidden connection between your mouth and your overall health. From sleep and airway disorders to nutrition and systemic disease, they're on a mission to help patients and healthcare professionals see oral health as the gateway to total well-being. So, let's get started.
Hello, everyone, and welcome to another episode of More Than Teeth podcast. I'm your host, Dr. Michael Bennett, and I'm really excited to be here today with Allison Allred to have her share her story about her son. Welcome, Allison.
Hi, thank you.
So glad you're here.
Thank you. So I'm just going to share my story then about my son, kind of what we've dealt with him over the last few years. It's been pretty incredible and pretty life-changing, actually. So I'll kind of start from the beginning of how we got on this journey and how we ended up with you and what we've noticed since we've been with you. So back in fall of 2023, my son was 3 at the time, almost 4. And I guess more like spring and summer of 23, we started noticing some symptoms with him as far as like squinting his eyes, rubbing at his eyes, behavioral problems, kind of complaining of his head hurting as much as a 3-year-old could complain. So I was like, okay, well, maybe he's having vision problems. So I took him over to an optometrist where they did a routine exam on him, found his eyesight to be good, but the optometrist told me that he noticed that he had a grade 4 optic nerve swelling, which is basically, grade 5 is like blind. So he was at a grade 4, meaning he had something that was pressing against those optic nerves in his eyes. So very swiftly, they had us go over to Primary Children's Hospital and get an MRI done. And the optometrist told me, he's like, this could either be a brain tumor or some, excess pressure around his brain. So of course, as his mom, I'm freaking out. Like, does my 3-year-old have this brain tumor? So anyways, we go up to Primary Children's Hospital. They do an MRI, and luckily there was no tumor, but they had found that he had a condition called IIH, or basically idiopathic intracranial hypertension. And that's where he has excess spinal fluid that surrounds his brain. But the term idiopathic means for no known reason. We don't know why this is happening. So in that moment, I knew it was I don't know if it was necessarily life-threatening, but it was pretty critical that we get him some relief right away. So they started him on a medication, some Diamox, which is basically a diuretic. They started him on a medication and they did a lumbar puncture. So they drained off a lot of that fluid from his brain. And then over the course of about a year or so, we just continued to slowly wean off his medication. His optic nerves tended to improve, but he still had symptoms. He still dealt with eye pain, headache, behavioral problems. Like, there was still a whole lot of things that kind of went along with it. And during this course of this 1.5 years on medications, we met with several specialists. We met with neurology, neuro-ophthalmology, endocrinology, autoimmune doctors. We did genetic testing and nobody could find anything. It was still idiopathic. But the mama bear in me was not allowing that to be the answer. I knew that there was something wrong. We've always kind of wondered if something's been up ever since, even before he was born, or I guess when he was born. He's been really little, like below 0 percentile in height and weight always. So that was always kind of a concern of ours. That was kind of just been on the back burner, but didn't really think it was causing any issues. So anyways, when we got to the end of his treatment with his neuro-ophthalmologist with getting his medication to wean off to where, he was not on any, I found a Facebook group that was all about kids that had this condition called IIH. But not ironically, but there's actually, all the specialists we met with told us that IIH is a condition that affects middle-aged obese women. Well, clearly he is a 3-year-old underweight little boy. So he met none of those criterias. So to me, I felt like I still had this drive of let's figure out what's causing this, because it's obviously not the same things that cause it in women, or at least in adults. And so I had met with, I'll just say this has been divine intervention, literally, that led us to this point. If I could tell you the whole story, I would, but it's kind of a process of how we even found you and how we got to seeing you. So I'm going to backtrack just a little bit. I was diagnosed in fall of 23. I had a baby in January of 24. So I'd been diagnosed for about 4 months at this point, but I had a lactation specialist that was recommended to me to help me with my baby, with my newborn back in January. Her name was Allie Jones, and she was phenomenal. She came to my house and she did an in-home visit for my baby. And while she was there, she looked at my son and my older son, and we got talking about him and kind of his story and where we were at with him. And her exact words, I'll never forget them. She said, "I feel like you called me here to help you with your older son. Yes, I'm here to help you with your baby, but she's like, I feel like can help your older son." So like I said, she's a lactation specialist, but also a myofunctional therapist. And so she kind of gave me a little bit of insight on what to do for him, what to watch for. She kind of opened up this thought in my brain of going down this rabbit hole of airway, myofunctional therapy, the way his everything is processing. But I kind of just threw it on the back burner, kind of just let it go for, a year or so while we finished out his treatment. And so I could feel like I could wrap my head around life again. So when we weaned him off his medication, like I said, I'd found this Facebook group, and they had mentioned there was a couple posts in there that I was reading about families, because they would just post questions or maybe things that they noticed when their kids had this condition, how things that they did that they then noticed an improvement in it. So I found a lot of them that talked about sleep apnea, and moms would say, "Oh, my kid had sleep apnea, and when we removed their tonsils, it got better." Or, when we put them on a CPAP machine or whatever, then their symptoms improved. So then I kind of had this aha moment of maybe this is it. Like, I knew that my son snored. I knew that he grinded his teeth. Like, his teeth were flat, like his canines were completely flat. He was pretty restless when he slept. So I started to go down this, okay, well, let's check his sleep. So I went to his pediatrician and asked them to order a sleep study for him. And our insurance didn't cover it because of his age. We had to go up to Primary Children's Hospital, and it was thousands of dollars. So I'm like, all right, at this point, I'm not going to pay thousands of dollars for his sleep study unless I felt like I absolutely had to. So I reached back out to Allie Jones. This is about a year later. And I had asked her, "Hey, can we maybe start myofunctional therapy?" Like, I didn't know a whole lot about the process of where things go. And she told me that before she did myofunctional therapy, she would like me to meet with you to kind of see what you had to say about his airway before we did myofunctional therapy, kind of doing them together. So anyways, she referred me to you. I made an appointment with you, met with you. And when we were in office, I feel like this is literally, I remember crying to you my first visit because I felt this sense of peace of like, holy cow, this is where we're supposed to be. We've met with so many specialists, so many doctors, and now this is my moment of feeling like I knew what we were supposed to do for my son. So when we were in office, we had done a CT scan for him, and you noticed that his sinuses were completely blocked. And I feel like this is important to share because of his symptom, or I guess what's improved since we met with you. That's why this is important to share.
Yes.
So his sinuses were completely blocked. So you had recommended that we go see an ENT to get those sinuses drained, or at least to get them cleared out while we were in the process of a sleep study and getting started with you on, expanding his airway. Because when you saw him, it was very obvious that he was really narrow.
Mm-hmm.
So anyways, we meet with an ENT, and well, before we met with the ENT, ironically, right in between my appointment with you and the ENT doctor, we had an appointment with his neuro-ophthalmologist, who's the main specialist over his IIH condition. And I told her that you had found that his sinuses were blocked in the CT scan. And so I remember reading on his MRI reports about a year ago that they mentioned something about his sinuses in the report. And so I mentioned it to his neuro-ophthalmologist, and she told me that, so she pulls up all his MRIs from the last year and a half, and every single MRI had blocked sinuses in them, like totally, completely blocked. And after I got thinking about it, I'm like, you know what? He has never had a boogery nose. Like, I know that sounds, okay, who does a boogery nose? But even when he was sick, like, he never dealt with boogers. He's never been able to blow his nose. And, and I thought most kids by the age of 5 or 6 could blow their nose. He could never blow his nose. He never had boogers, never, anything like that. So she pulls up his MRIs and she tells me, like, yes, obviously he has blocked sinuses in every MRI for the last year and a half, but they didn't really think a lot of it because a lot of times people will come in for a single MRI. And if they're blocked, their sinuses, it's because they have congestion at the moment. but not chronic congestion that goes on, for a long period of time. So we met with her and she confirmed to me that yes, for a year and a half, there's imaging that's proving his completely blocked sinuses. So we then meet with ENT, where they then tell us, oh, well, you just told us that you did a sleep study with Dr. Bennett and it shows he has sleep apnea. Let's go ahead and remove his tonsils and adenoids. And I was like, whoa, whoa, whoa. That's not why I'm here. I'm here because we need to get his sinuses cleared, but I'm working with Dr. Bennett on treating his airway, because clearly we can see that there's some narrowing, and I'm all for the least invasive if possible. And I believe that we were given adenoids and tonsils for a reason. So I don't want to just go cut them out. I'm like, I don't want to take something out just because that's clinically what most providers do. And so the nurse practitioner that was talking to us at that visit was very adamant, like, let's just take out his adenoids. Like, it'll help him so much. And I'm not ready to do this. And so I asked for the doctor to come in, because this was just the nurse practitioner that was working with him. And he came in and he's like, all right, let's just do a scope of his nose. Let's see what he's dealing with, like if we even need to remove adenoids. So he puts a little camera up his nose and he actually laughed at me in the room, not in a rude way, but laughed as like, I would never touch these adenoids. He said, they're so small, they're not blocking his airway. I would never take out his adenoids or his tonsils because they're tiny. So to me, that was another moment of like trusting my gut. I'm just treat his sinuses and let me go back to Dr. Bennett. So anyways, we did that whole treatment. We cleared out his sinuses. We did all of these things. And then we meet back with you and we start expansion. And I will tell you, this whole process of expansion is incredible. So we started expansion in June of 25, I believe, is when he got his expander on. And I wrote down a list of symptoms that have improved, and I kind of want to read them to you and I can expand on them. But like I mentioned, improved sinuses. That was the number one biggest thing I've noticed, where he actually has mucus that he has to blow his nose.
Draining.
Yes. And so to me, I'm like, okay, well, obviously he had some narrowing somewhere where he could not drain out his mucus. His headaches have gone from once or twice a week, and that's once or twice a week off his medication. He was chronic headaches all day, every day before we started medication because of his pressure in his brain. But as we weaned off medication, he was about once or twice a week. And since it took a couple months, probably about a month or probably 2 months of having his expander, for him to cut his headaches now down to maybe one a month, maybe. That to me was huge, because I'm like, that was my biggest thing for him, was he was miserable. He needed these headaches to resolve. And also, this was something that I didn't realize until I was kind of going through my notes before we did our podcast, that he's been in the 0 percentile his entire life. 0 meaning like below 0.
Wow.
And not on the charts for height and weight. When he just did a checkup back in November, he's now in the 1st percentile for weight, which is not a lot, but when he's below 0, to get on the charts was a huge improvement for us. And 6th percentile for height instead of 0. So biggest growth spurt he's ever had.
Wow.
I know that you kind of mentioned that to me when we first met with you. You're like, don't be surprised if you see a growth spurt, because when we improve his airway, he's getting better sleep. And you grow the most when you're sleeping. And so I'm like, clearly there's some obvious improvement with a lot of these things. And then, so 2 other things I had thought about was his appetite. I don't know if this is related necessarily to his expansion, but his appetite has increased significantly. He's never been an eater, which I think contributed a lot to his weight. And it's hard for me to distinguish, like, okay, is this normal 3, 4, 5-year-old behavior, or is this actually an improvement? But I figured I'd list all the things that we noticed that were a really big improvement for him. And I would say one of the biggest changes of all has been his mood and his behavior. He's way happier. He's way more friendly. He's way more social. His temperament is so much more calm, which that was something that kind of we realized was an issue with all of this beforehand, because he was a really moody child. And obviously he wasn't sleeping well. He wasn't eating well. He was having headaches. He was having all these issues. And so, yeah, those have been the biggest improvements that we've seen. And I'll tell you, people that see him now, that saw him a year and a half ago, say I have a different child. Like my child is completely different for the better. He's totally improved in so many of these areas that I'm like, I don't know what we ever would have done if we didn't find your help.
Yeah.
So I know that was kind of a lot, but I feel like a lot of those points were very important to understand why we got to where we were. It wasn't just I woke up one day and said, oh yeah, sleep apnea. It's like I was on this mission to figure out what was wrong with my child. Like I fully believe in I love doctors. I love what they have done to help us, but I love my intuition. And that's, if I could give any advice to any mom or anybody that's listening to this, follow your gut and be aware of people that are placed into your life and be open to other ideas that they may have, because it's literally changed our life. So,
wow, your boy is so fortunate to have you as a mom. And, as a provider, I have learned that same thing, that when moms or dads come in and they say, I just don't feel right about that, or that makes sense, I just often will say that, follow your gut. Don't do it if it doesn't make sense. And so I'm glad you followed that. That's so key.
yes.
And I'd want to comment then on, he's improved so much. And we activated an airway team. And my part was to grow the anatomy to a more normal size by using an expander. And we're still in process of that. But also the ENT is so good to have them review and then have the neurologist on board that, hey, those sinuses they're like really important. What's more important than the human airway?
Right.
And establishing that. And that would be another take home that I would provide for any listener out there. And that would be that the human body has a built-in physician. And if we can get that human body breathing and sleeping really well every night, then any therapies that we undergo should work better, because the body's working with the therapist, whoever that might be. And that's certainly been the case. So that pent up growth that you mentioned, that I've seen that. I can't tell you how many times I've seen that. So who knows, might be towering over everybody someday.
I hope so. I'm like, it's been awesome to see. My husband told me just a couple weeks ago, he's like, he looks like he finally needs new clothes. Like he's been the same size for so long, and he's tall, and he's taller, I guess, than he was. Like he's always been in the same size clothes, and he's finally seeing a really big improvement.
Oh, that's so good. And that accompanying appetite increase is, the body's saying, hey, I need some building blocks. I'm ready to grow. Tons of growth hormone every night's going on. So I just need nutrition to keep him going. So that's awesome. And I can't tell you how frequently I see this same type of scenario in adults and children. It's literally, there's no age bias at all. It's just everybody has the need for a good airway and a good night's sleep in order to have their best health. I'm just so glad he's doing well. And I'm so glad you're his mom.
Well, thank you. I see his improvement, and now I see in myself, like, crap, maybe I need to get my airway. I'm a snorer. I know that. I'm a restless sleeper. And I'm like, if it's made this much of an improvement for him, I can't imagine what it would do, still, like, for me and for everybody else that I know that suffers with these problems. So I'm
cool.
Very grateful.
So cool. Well, you've been awesome explaining everything. And I hope that this resonates with somebody out there. And I so appreciate you taking some time as a mom. We both are parents. We want our children to have the best possible life that they can have. And so I have grandchildren now, and that's exactly the feeling. Like, let's give them the opportunity. So thank you. And who knows where this will land, but I'm so glad you discovered it and your family's benefited from this. So thank you. Do you have any parting advice or comments you'd like to make?
I kind of mentioned it before, but like I said, trust your mom gut. Do what you feel is best, and there'll be no regrets. Like it may take some time. And that's one thing I've really had to learn, is trust the process. This was not an overnight change. A lot of people want like instant gratification. And if there's anything I've learned, that it's taken us 3 years to get to this point of major improvement. So take your time, trust your gut. And that's my biggest advice I could give.
Great advice. Thank you so much. All right. You take care.
Hey, thank you.
Thank you. Bye.